seen that you offer a bunch of different types of procedural solutions. There is the ultra density, ACell PRP, FUE. How do these differ, like in kind of the processes, and what type of patient would want each one of these types of procedures? There's also some laser technology as well.
Sure. Well, I mean, I always refer to these as all the tools in my toolbox. And I like having as many possible solutions as I possibly can for individual patients. Now, you can look at things from the surgical standpoint versus the non-surgical standpoint. Invasive, non-invasive. And with surgical, obviously what we're highlighting is the ultra-density procedure. We're removing really large volumes of hair in a multiple follicular unit method, meaning that we're able to use a little larger graft and create a greater appearance of density while maintaining fine, ultra-fine hairlines, and thus the ultra-density. Of course, there's FUE, and everyone is now, I think, has really become more aware of follicular unit extraction, different approaches using FUE. FUE obviously is another approach for harvesting hair. It's not a specific surgical process in and of itself. It's just another way that the hair gets harvested. There's different tools to do that. There's the NeoGraft, there's SafeScribe. There's different tools that we use to harvest hair with follicular unit extraction. Of course, we do follicular unit extraction in our office when it's appropriate. Not every patient that comes in is an obvious good candidate for follicular unit extraction versus, say, an ultra-density procedure. So I think when you lay it out and explain the pros and cons of those surgical procedures, the patients get a very clear understanding, and then they're the ones that say, well, that sounds to me like this is a better approach. So I think that surgically speaking, those are the two aspects, but making sure you understand that everything under the auspice of surgical intervention with hair transplant really is still basically a hair transplant procedure. How you harvest the hair, how you dissect the hair, and then you, with the skill as a surgeon in your team, how you decide to redistribute that, those are all small variances. A lot of people actually think that FUE, or follicular unit extraction, is this separate procedure unto itself that is far superior. And unfortunately, just nothing could be further from the truth. They've associated the name NeoGraft with this specific procedure. It's a scarless procedure. I do NeoGraft all the time, but it's not a separate procedure. It's just a different way to harvest the hair. And there's pros and cons to it, which we can get into later if the listeners want to hear. I know there's a lot of it on my website already, but it just depends on what the individual needs. As far as non-invasive procedures or minimally invasive, we've got injectable procedures, the ACell PRP, which is something we've been doing now for a couple of years and getting great success with it, with the right patients, of course. And what we do is basically we draw off the patient's blood, and we use an FDA-approved centrifuge and device for separating out the plasma, and we mix the plasma with a product called ACell. And ACell is an FDA-approved product which has been used extensively in plastic surgery, and it's been shown to really stimulate epidermal cells to reproduce by stimulating stem cells. Wow. So we know that it's very effective. Some guys in my industry got the bright idea to let's try to use this with transplanted hair. Let's try to see how it works, and sure enough, they got a tremendous improvement in the growth of the hair.
Wow.
So we took it another step further and decided, let's try this mixture and use it as an injectable. And under the right set of circumstances, when you do use it properly with the right protocol and the right type of, you have to create a little bit of trauma to the scalp, a little bit of microneedling. And when you do that properly, in many patients, particularly in a lot of female patients that have diffuse female pattern hair loss, it has been a great go-to approach for helping those patients. What is that ACell PRP not good for? Well, the male patient that comes in that's got a class 5 or a class 6, and he's got the horseshoe. I'm not going to be recommending ACell PRP, but the 32-year-old woman who's got hair that's thinning, diffuse loss, and wants to do a transplant, but she's not a really good candidate for a transplant because maybe the hair is thin and fine in the back as well. Well, listen, now we have a tool in the toolbox that we can use.
Awesome.
It's not 100%. I've had a couple of patients who've been non-responders, but overall we've had very, very good results. And of course there's, as you mentioned, laser therapy, and that evidence is irrefutable, low-level laser therapy, and there's different systems on the market that can be used to treat for hair loss, but low-level laser therapy is the evidence is irrefutable. It definitely helps the hair, it improves the hair, it makes it thicker, fuller, and stronger. So we've got different tools to use for different patients.